So let's look at a complication in pregnancy known as placenta previa. So placenta previa is a pregnancy complication where the placenta partially or completely covers the cervix. That's the opening of the uterus. This can cause severe bleeding during pregnancy and delivery and requires close medical management. So in placenta previa, instead of the placenta to be implanted in the upper uterine cavity, is rather implanted in the lower uterine cavity, covering the cervix, resulting into severe bleeding during pregnancy and delivery. So we have a diagram of a normal placenta. Here you can see the placenta implanted in the upper uterine cavity, and here is the placenta previa, where you can see the placenta implanted in the lower uterine cavity occupying the cervix. So what are the types of placenta previa? We basically have four types of placenta previa, which are the complete, partial, marginal, and low-lying placenta previa. So in complete previa, the placenta fully covers the cervix. So this is a complete previa. Here you can see the placenta fully covering the cervix. We have partial previa. The placenta partially covers the cervix. So here you expect to see the placenta around this area partially covering the cervix, but not the whole cervix entirely. We have marginal previa. Here the edge of the placenta reaches the cervix but does not cover it. So in a marginal previa, you expect to see the placenta here reaching the edge of the cervix but not covering it. We have low-lying placenta. Here the placenta is implanted in the lower part of the uterus near the cervix. So here you might have a placenta around here, but it wouldn't reach the cervix itself. So what are the symptoms of placenta previa? There's usually painless vaginal bleeding in the second or third trimester. That's the most common sign. Uterus is soft and non-tender on examination. So on examination, the uterus is usually soft, but the patient does not complain of pain when you touch it. No contractions typically associated with the bleeding. So the bleeding does not come with uterine contraction, it occurs without contractions. So what are the risk factors for placenta previa? There's a previous placenta previa, prior cesarean section or uterine surgery, multiple pregnancies, e.g. twins, triplets, etc., smoking, maternal age greater than 35, high parity, that's a woman who has given birth many times. So how do you make diagnosis? Diagnosis is usually by ultrasound. It could be transvaginal or abdominal. It is the standard method to detect placenta previa. It is often diagnosed during routine second trimester anatomy scans. That's approximately 18 to 20 weeks. So how do you manage placenta previa? This depends on gestational age, severity, and symptoms. If asymptomatic and early in pregnancy, observation as the placenta may move up as the uterus grows. If bleeding or later in pregnancy, you do hospitalization for monitoring, you give corticosteroids if early delivery is likely to mature baby's lungs. Avoid intercourse and heavy exercise. No vaginal exams should be performed. So what's the delivery plan in placenta previa? Cesarean section is usually required if the placenta still covers the cervix at term. It should be scheduled around 36 to 37 weeks or earlier if bleeding is uncontrolled. Heavy bleeding requires immediate medical attention, possibly emergency cesarean section to save mother and baby. Thanks for listening.